And then COVID hits, right? Everything gets canceled. Just a short little video for us to remember our quarantine.
They have a jumpsuit delivery and they've allocated some for us for the hospital. So
okay. We got COVID. Absolutely no energy.
Did I mention, PPE? Everybody knows the term PPE. Before COVID, I'm sure only healthcare workers knew what PPE was.
So welcome back to our channel. If you are new to our channel, my name is Maya Acosta.
And I'm Dr. Riz Bukhari.
And we are a husband and wife team in the Dallas area. Actually, hashtag Team Buki. So my husband, Dr. Riz, is a vascular surgeon. You teach people about the benefits of eating plant-based foods.
That is right, yeah. As we learned about it, it became a part of our lifestyle and actually really a central focus of our lifestyle. And I teach it to my patients as a part of their lifestyle modification, which I try to get them to change their ways and the things that cause them to have their disease. And we've incorporated it into our lifestyle as well.
Yeah. So together we formed an organization called Plant-Based DFW. We are in Dallas. DFW means Dallas Fort Worth, and that's basically a little bit about ourselves. And for those of you who already follow us and are familiar with our work, we wanted to do a 2020 recap video.
Yes. So in general, the stuff we teach is about lifestyle. It incorporates nutrition and many other aspects of lifestyle that teach wellness and how to be healthy, happy, and live longer. 2020 recap. 2020 has been a very interesting year, right?
Right.
It's been eventful, obviously. BC, before COVID.
Yeah.
And then AC, I guess, after COVID, right?
Yeah.
So, I think then, things were pretty normal for us. We were doing the stuff we've been doing for a few years now. Community outreach, giving our talks and inviting speakers and doing our potlucks and our monthly walk with the doc. So kind of our routine.
Yeah. Actually, if you want to know more about what we've done in the past, I'm going to put a link in the cards with our 2019 recap video, and that way you'll learn a little bit more of what we do. But we are part of organizations like the Physicians Committee for Responsible Medicine, Walk with a Doc. We're part of Plant Pure Communities, American College of Lifestyle Medicine. I miss getting together with all of you guys.
Yeah, absolutely. I do feel very isolated, and I'm sure everybody does. Because we don't socialize like we used to. We don't get together with people. There's people I haven't seen in forever, who we used to see several times a month.
Yeah.
It's crazy.
My mother and I were in DC early January.
You went to see Dr. Barnard, right?
Yeah. I went to one of his intensive Kickstart programs. 2 days of intense information on how to get started on a plant-based diet, and it was really for my mom. But I took advantage of it because I love DC and I love the cold weather, and of course the Barnard Medical Center and the entire team. Well, Happy New Year, you guys. I started off the year at the Grand Hyatt in Washington, DC with my mom. I actually wanted to bring her out here to the Kickstart Intensive program that Physicians Committee for Responsible Medicine was having.
Yeah, that was almost exactly a year ago. It was last January,
Yeah.
right? Mid-January.
And I took my mom kind of on a tour, so I took her to some historical, well, there's obviously a lot of history there.
She'd never been to DC before,
No,
right?
no.
So that was new for her.
Yeah.
Yeah.
And so also, speaking of PCRM, before I forget, this week, like in 2 days, starting January 19th, the Physicians Committee for Responsible Medicine is going to run a course. It's an 8-week course called Fight COVID-19 with Nutrition. Yeah. And you were part of it last year.
Yeah, yeah, it was nice. I got to participate in their first 8-week course, and I think we'll be. They've asked us to participate again, right?
Yeah. So you participated last time, but I've been invited to join as well. So to offer some tips, I guess.
I think they figured out she's the brains behind the operation, and so they invited her to be a part of it as well.
So we're going to be together, and so that's a lot of fun to do some, I enjoy doing things together with you. So anyway, that's that. So I started off the year in DC. And how did you start off the year? How was work going prior to all of this?
Work was busy. For me, it was normal, and my vascular work at the hospital and in the clinic, and then our plant-based work. So we were very busy, if I remember. Also, I had started my hydroponic garden. I'd been excited about the idea of growing our own plants, especially green leafy vegetables, which are very near and dear to my heart because I push green leafy vegetables as a part of a healthy diet for vascular health, right? That was very exciting. We experimented with growing green leafy vegetables, even some herbs, and then tomatoes and peppers. I love peppers, and they're fun to grow. They're just so much fun to grow. Microgreens.
Microgreens.
Yeah.
Yes.
That was a lot of fun. Yeah. That was good.
I loved it. We live in a small space, but we took our dining room and made it into a garden.
Yeah. It was overrun with buckets and buckets of hydroponic plants all over the place.
And the sounds of pumps running because you have to circulate the water. And so we did create a whole playlist in our YouTube channel where you can see how to get started on creating your own hydroponic garden. But we have a lot of content related to growing our own vegetables in 2020 that I still have not released because I was putting out a lot of other content. But if you're interested in learning how to grow your own green leafy vegetables, follow us, and we're going to continue. When are we going to start a garden this year?
Oh, it's time. We probably should have already started our seedlings.
Yes.
So the good thing about growing indoors and doing hydroponics is it leads to an earlier harvest and a longer harvest period before the lettuce just doesn't grow so well by the mid to late summer. Or at least that's what my experience was last year. So we need to get going. We're missing out on good harvests.
Yeah. I will say that you did the right thing last year. You started on New Year's Eve.
I did, yeah.
It is true we have had a slow start. This video I would have wanted to have the 1st of January, but just as a side note, what I've done these last 2 weeks is really have taken the time to go through our space, our home, and just have started to declutter because we expect that 2021 is going to be a lot like 2020 in terms of being able to focus, have our downtime, being creative. And so I've gotten rid of a lot of things that I no longer need, and it's been nice to be able to donate.
She started spring cleaning a little bit early.
Yeah, and so you can see in our office space, this is the room where I do all the interviewing. We do our podcast together. This is also where I do all the editing and content creation. I shifted things around so it's less busy. It's more toned down. It allows me to focus. And you feel the difference, right?
Mm-hmm. Yeah.
Okay, moving on. Let's talk about what a couple of things we had planned for 2020 and didn't
Yeah.
happen.
Well, so BC, before COVID, or pre-COVID, we had a lot of nice events planned for the spring, right? We had invited Dr. Michael Greger to come to Dallas for a talk. This was going to be a big and very successful event. So many people wanted to see him, and we were so excited to come have him be here and host him.
Yeah.
And then we were going to also have Dr. Michael Clapper. He was part of, with Plant Pure Communities and Moving Medicine Forward as part of his initiative to educate medical students. And so we had arranged several things here, both with the medical schools and in the community. And then lastly, our retreat. We were going to have our first lifestyle medicine retreat, which we were going to organize with our good friend Marla.
Yeah, Marla Ablon, she's the one that invited us to spend New Year's Eve with her and a small group of friends, and we brought in the new year with her. And so it was just like, gosh, there was this nice momentum that was building up. She has a lake house about 70 miles from here or so. And we had basically coaches and doctors, including ourselves, and we were going to be part of a 3-day intensive kind of lifestyle medicine. Yeah.
We had gone out and gotten equipment to do on-site testing for hemoglobin A1C, for diabetes, and for cholesterol, blood pressures. We were going to do some really nice basic biometrics for people to start, to have pre, and then to do this, and then maybe go on and make some changes with their lifestyles. And then we were going to, as a courtesy, test them down the road and see how things were going. So we had really put a lot of work into this, and we were very excited about it.
And we had a plant-based chef.
Oh, yeah.
That was going to cater. Anyway, I still get excited about it, even though right now we can't do anything in person. So, And then COVID hits, right? Everything gets canceled. And suddenly it's like, oh my God, I'm going to have to stay home. I want to hear from your perspective, what was happening in your world as a healthcare provider?
That screeching halt is kind of an interesting thing. It did change the whole landscape of healthcare. And back in March and April, we were in some, quarantine or shelter-in-place orders, and they were really getting worried about what was going to happen to the hospitals as far as, when COVID patients started showing up, and our resources, both from a hospital bed availability, ventilator availability, staff availability. Did I mention, PPE? Everybody knows the term PPE. Before COVID, I'm sure only healthcare workers knew what PPE was, personal protective equipment. Now everybody knows the term PPE. And so all of these resources, they were so worried about how to manage them. Around that time in March and April, when we were doing these shelters in place and also the quarantines, we started to cut back on elective healthcare. And I'm not exactly in the elective healthcare field. I'm the people I treat are not. It's not like a hernia or a facelift or some sort of or even a knee replacement or something like that, which can be put off. At the same time, we were looking at how to ration the care that I gave, and the reason they were doing this was because they didn't want us to fill the hospitals with the patients from our elective surgeries and therefore not have the space and resources available to treat the COVID patients. So there was a point in April where we basically shut down elective surgeries and we're only doing emergency cases. That was partly state mandated. They said that we had to reserve a certain percentage of our hospital beds for COVID. It was a kind of a challenging time. This was new. All of it was new to everybody. And so we come up with policies and processes. They may or may not have been perfect, but we were trying to do the best we could. And then we would readjust. And then, as we came out of May and June, we started to resume a more normal schedule. And it was because we found we were able to reserve a certain percentage of our hospital for COVID patients and still maintain our elective surgery schedules. And by then, and you'll see, we will talk about this, how PPE resources were extremely limited early on. And there's a segment which there's some stuff we did to help provide PPE for the community in our hospital. And so, but later on, as they ramped up PPE production, and we were able to find resources to bring PPE into the hospital, so then we were able to then now resume our elective surgery schedules and yet still reserve enough space for COVID patients. I'm chief of staff of my hospital this year, so I've been very involved in all the planning. And so I kind of know this from the inside out at a very high level. What we saw is this kind of surge in April. And then because of our shelters in place and our quarantining, we did a pretty good job of controlling things. And we saw a spike in cases, but it came down. And we all kind of took a collective sigh of relief and thought, okay, we figured this thing out. But, you know, many things kind of served to sabotage this. I mean, we had a lot of disagreement in our society about wearing masks and social distancing. A lot of people didn't pay attention to it. Here comes Memorial Day and then July 4th holiday, and a lot of travel was occurring. People let their guard down, and we started to see another surge. What happened over the course of the summer is we started to see the number of cases about twice what we had in April. And so we thought April was a peak, but then now, as far as the number of positive cases we're seeing at our hospital, the number of beds that are full, was at about twice that number. Yet we were able to manage it. That stayed pretty steady until schools opened in the fall. So and then we had Thanksgiving, Christmas, and New Year's. And what's happened now is we're seeing volumes 4 to 5 times higher than we did in April. And just think about how worried we were in April and now, and I know everybody knows the news. It's kind of, we are in crisis mode as far as the hospitals are concerned. Just last week, my hospital was 76% full with COVID patients. And we have shut down all elective services. And the sad part about that is there are patients who need, this is a trickle-down effect. 2 things are happening. We're sending home COVID patients now who we would have admitted in April, but we don't have the capacity to admit them. We don't have the beds, we don't have the manpower. Over half of our staff are what we call travelers. We've brought them in from somewhere else in order to meet our staffing needs. So we've shut down the elective services, and what's happening is I've got a colleague, he's a general surgeon who does a lot of cancer work. He's got 2 patients with colon cancer. We can't find a bed for them in the hospital for him to do the operations. I personally have a couple of patients, 3 patients with abdominal aortic aneurysms that have been enlarging and I need to fix. A patient who's got a symptomatic carotid. Basically that means they've had a stroke. They're a ticking time bomb. They're going to have another stroke. Who needs a surgery. I've got another patient with gangrene of his leg who needs a bypass operation. And the thing is, the hospital's not trying to prevent me from doing these things. They say, sure, put them on the schedule. And if that morning we have a bed, you can do the case. Well, I have canceled 10 cases in a row in the last few weeks. And so it's very challenging. That's kind of where we're at.
Yeah.
You know, that's my perspective from, the hospital standpoint.
That's devastating, and that's why I feel the need and the sense of urgency. Share this information with people. And I've always said I don't want to get into the politics of what people believe about COVID, whether they believe it's real or not, whether they believe masks are effective or not. Just because you're not seeing it, because you're not working at a hospital, because you're not in that immediate environment, just because you don't see it doesn't mean it doesn't happen. But I know this because you tell me regularly what is happening. As we continue to spike, you come home and you tell me what's going on. And I keep saying, people need to hear this because you hear what's on television or what you read, in the newspapers or see on social media. But the truth of the matter is that if you have a loved one that has a heart attack, a stroke, a car accident, they may not be as attended to immediately like what you were used to before. Yeah.
Our waiting periods, we have typically 5 to 8 patients waiting to be admitted, and that could be anywhere from 18 to 48 hours. They're sitting in the emergency room in a bed in a hallway. So these are sick patients because otherwise they wouldn't be admitted to a hospital, yet they're just sitting in a hallway waiting for a bed in the hospital to open up. The other thing about, it's very interesting about the whole COVID crisis, the average COVID patient stays in the hospital around 11 days. Before COVID, our average length of stay in the hospital was just a little over 4 days. So we were able to turn over those patients, get them out of the hospital, make new beds available for whatever patients needed. So we had a very good hospital management system in order to always make sure beds were available for patient needs. Now that we're overwhelmed with COVID patients, think about it. 3/4 of our beds are COVID patients, and they're staying 11 days, not 4 days. They're staying almost 3 times as long, and they're occupying 3/4 of our beds. So the bed availability has really come to a screeching halt.
Yeah, okay.
I tell her these stories when I come home every day, and she keeps saying, you need to share this stuff, you need to share this stuff. And I don't know, sometimes when I get home at the end of a long day, I don't feel like sitting in front of a camera and making a video. But I think she has a point, and there's some great stories to be shared, which I think it would be nice to let the public know and our audience know. And so that's going to be one of my initiatives for this year, 2021, is to maybe, even if it's just a 2-minute story, I'll make an effort to share. Especially when she says, "Oh, you need to share that with people." Yeah.
You could just come in the room with this setup and press record.
Yeah.
But that's a good idea. I'd like to talk about DFW Care, the organization that we learned about early in the pandemic. I want to say it was in March. I found out about them. To make a long story short, I found out about this organization through our Nextdoor app. I immediately contacted them. They're a local Chinese American group, nonprofit, who over a period of 24 hours as this was happening, developed themselves, organized themselves, and decided that they wanted to fundraise enough money to provide PPEs for people on the front line.
Mm-hmm. Yeah, that was an absolutely amazing effort. And so when Maya reached out to them, and then I made contact with them, I found out that they were creating all sorts of creative distribution systems to supply people at different levels and different need, and they were working with hospitals, and we got hooked up with them. This was very early on in March and April, when my own hospital didn't know if they were going to have enough PPE to provide our staff in order to take care of COVID patients.
Mm-hmm. Hi guys, Dr. Riz and I are meeting up with a group of volunteers who will be donating some masks and face shields for us that we can give to the hospitals. So there he is. Coming in to pick up more items today.
Yeah, they have some jumpsuits. They have a jumpsuit delivery, and they've allocated some for us for the hospital. So
okay.
We're doing.
So there's the whole box that's 30.
Okay.
And then 30 in here, about 20 of them are large, and 10 of them are large and 20 of them are small.
Okay.
So there was 2 big boxes. KN95, there are 20 apiece, so there are 500 of them in total in here.
Okay.
And this is level 3, where we collect over 10,000 face masks and wipes and hand sanitizers and alcohols and face shields. And all of those donations have gone into different communities, like police department, firefighters, the nursing homes, etc. Because
we did get hooked up with them and received several shipments from them over the course of a few weeks, and I was able to share those with my hospital. And I'll tell you, the supply guy, Philip, who I've known for years, that's one of the great things of working in a smaller hospital, is you get to know everybody. He was amazed and surprised that, there's this group that's doing it, and the physician who's actually gone out and grabbed it and bringing it back to the hospital. But also it took a little pressure off him, knowing that, some stuff was coming in while he's sitting there scrambling to try to find supply lines across the country. So he was very, very grateful for our efforts.
Yeah. We were able to interview Karen Wong. It's also incredible that at the same time, because they are a Chinese American group, some people were not interested in receiving the PPEs. And so that's one of the things that Karen shared with us as one of her challenges.
We also work with Diane Doyle, who's a close friend of ours, and she and many of the people that she works with in her organization were making face masks and face shields. My hat's off to them. They were working around the clock and showing a lot of ingenuity in coming up with these things. She shared a lot of that stuff with us. I was able to share those with people at the hospital. What the nurses at the hospital were doing was wearing their N95, and then they were wearing these masks over it. And then I was also able to distribute these to the nursing homes, which they didn't have. In the hospital they had to wear N95 stuff, but in the nursing homes they weren't able to get these supplies, so they were extremely grateful to get these face shields and face masks.
So this friend is also part of the plant-based community here in the Dallas area. So we collaborate and work together on different things. So we were very touched when they reached out to Riz and said, we can put our army together of women, and I'm sure men too, I don't know, but women. And they were, like you were talking about ingenuity and how they were trying to figure out how to do the film using shower curtains or what was the other sheet protectors?
It was really interesting. She showed me some of her prototypes so you could see the evolution. And she had me try on a couple, and then I was like, no, sorry, that's not going to work. I can't see through there. To the point where they came up with just absolutely wonderful face shields.
Yeah, I'm telling you, these two organizations and what they did, and tons of other ones that we never knew about, coming together at times that are so devastating and overwhelming is like the best way to direct your energy, help other people.
Yeah.
Let's talk about how we kept ourselves busy when we were on lockdown, and we didn't stay bored, that's for sure.
Well, I mean, from a personal standpoint, I had a little more time on my hands because I wasn't doing my elective surgeries at the hospital. I was still working at my clinic, so that kept me busy, although everybody's clinic volumes were down. Patients were not wanting to come in because they were scared they were going to get COVID, despite the fact that probably the safest place to be was in our clinic because we have the protocols in place and everything was clean, and my office volume was down or my clinic volume was down. And to this point, still, we're down about between 35 and 40% slower than we were the year before. So we did a lot of picnicking, didn't we?
Yes.
Yeah, and I'm sure you've got some video we can share.
Just a short little video for us to remember our quarantine. Another picnic.
Clean out, I bet you clean out the whole.
Yeah.
That was nice. As the spring, evolved and it was getting warmer, I enjoyed getting out there. We have a really wonderful park that's a part of our community we live in, with a pond and a walking track that's about a mile around. We went out there several times a week and set up our hammocks and did some picnicking and got to interact with the wildlife too, right?
Yes,
we have a lot of wildlife there.
I ended up going online and finding some nice little things from Amazon that I can use anywhere. So a little table that you can travel with, and a little set with plates and utensils so that you can reuse. Even now, I think if I go to a potluck, I can have these things with us. So because we're kind of the mentality of like tiny housers, sailors, it's easy for us to be comfortable with the basics, pretty much.
Yeah. We walked every day, almost, always at least 2, maybe 3 miles a day.
Yeah.
We used to work out at our community gym, which is a part of our complex.
And then yoga across the street?
Yeah, and yoga, in the retail center, which is just not even a quarter mile from us. We would walk and we would do go to the gym and we would do yoga. The gym and the yoga went away because they shut down. We got back into the swing of things and started exercising here at home, like obviously many people did, right?
Yeah.
We broke out my old P90X system, which I had done years and years ago, and we got pretty good about doing that on a regular basis.
It was such a bonding experience for me because initially you and your daughter, one of your girls came home for that during the quarantine time. So we had a lot of time with her. I thought it was just, oh, you guys do it together, father and daughter working out and all that. And then I think day 2 or 3, I jumped in and
Maya said, I'll join you guys. And I went, what?
I'm not a person that likes to be at the gym.
And then, she never missed a day after that. And we were doing it 6 days a week. Despite the fact that I think we live a healthy lifestyle and we eat well, we were even cleaner with the way we eat. We were doing a lot of cooking at home.
A lot of smoothies, salads.
And I became very consistent with making my smoothies on a regular basis. The healthiest way to eat is to cook at home. My lifestyle, when I'm working, I'm not always at home. So, I do the best I can as, being whole food plant-based, but, things sneak in and, people will use oil and more salt than you want and more sugar than you want. And so we also became, I think, very much more healthy in the way we ate. Right? Because we were cooking at home.
We live in a small space, so we have a bedroom for the girls. And the bed rolls up into like a credenza, it's a hideaway kind of bed. I brought in a freezer that I had in the garage so we can stockpile during that whole lockdown.
Oh boy, we had 3 months worth of food and we didn't have to go shopping for a long time.
So the closets turned into pantries in that same room. We had a bed in there, we had a freezer. You brought home a treadmill from work. In that small space, 3 of us were working consistently doing cardio, yoga, weightlifting. It was crazy. Of course, we kind of spread out when we could, but we did it. And it was awesome to do it all together.
Also, how did we spend our time? We were doing a lot of cooking, making sure we exercise regularly. But then I think we had to also, from our plant-based DFW standpoint, all of the events, which we always did 3, 4, 5 events a month, came to a screeching halt, and we were trying to find a different way to reach our audience. So Maya has been working very hard now in establishing our online presence, more specifically our YouTube channel and our podcast.
Yeah.
Hello everyone, I'm Dr. Riz.
And I'm Maya, and our organization is called Plant-Based DFW. Welcome to the Plant-Based DFW Podcast Weekly Show. We are your hosts, Dr. Rizwan Bukhari and Maya Acosta. So I did an intensive, a 7-day training on YouTube, understanding it all, how to content create, understanding analytics, optimizing SEO, all of that. And then I was the recipient of a scholarship for my first ever podcast conference that I went to, only it was virtual.
Went to online.
I went to it online.
Gosh, who knew what Zoom was before the pandemic, right? And now everything's Zoom, right?
Yes.
Yeah.
This conference was supposed to be in Dallas this year. And it should have been only maybe a 2 or 3 day conference, but they spread it out over 2 weeks, understanding that most people have lives and work. And so there were events happening every other day, and depending if you paid extra, you get extra. But you also had the opportunity to socialize and network and speed, kind of like the speed dating, but speed network. To get to know each other. So it was spread out over 2 weeks, and it was perfect because there was so much information. So I learned that. I took a training class on social media, the various 4 platforms that people use. So I just learned a lot, and on top of going to as many online plant-based summits.
And then I think she focused on doing a lot of Zoom interviews with many different people. And then it takes a lot of work to edit those and put them together. So, and she was very consistent in making sure she got at least 1 podcast out a week. And then she also started doing some YouTube videos, what we're doing, cooking videos. And then she's also putting up some of our previous content, like some of the lectures I've given and stuff like that.
Yes. A lot of times I share the content to our podcast platforms that we're on now, about 11 or 12 that are just strictly audio podcast apps. I find that lectures that you give do well on that platform too, because people can still drive and listen to you giving a lecture. And if they want to see the visuals of it, they can just go to the YouTube video.
Absolutely. So those have grown a lot throughout the course of this year.
Yeah.
I guess we're going to continue to work on that.
Yeah.
You know, I think there's light at the end of the tunnel from the COVID standpoint. I don't think we've seen the worst yet, but I think that we're going to turn the corner in the early part of this year, maybe. But things are not going to change all that much for several more months. And so I think that we're going to continue to focus on our online presence and trying to reach people that way. And then pray for a day where we can start to resume some more in-person stuff. And then I personally, since I wasn't giving talks, I participated in a lot of summits. And I was very fortunate to be invited to several different things, summits and interviews. I'm sure you'll be able to share that.
Yeah.
You know, you'll be able to create a graphic to show people what we've been doing. Right?
So a lot of times when he is involved in something and I have the ability to record the content too, I reshare it to our YouTube channel. One of your better ones that was viewed a lot was when you were on Chef AJ.
I had a lot of fun with that.
I love the dynamic between you guys.
Yeah, I met Chef AJ on the vegan cruise that we did in, what was it, 2018?
2019.
Was it really?
That's the year that we did a bunch of stuff.
Yeah, wow. So yeah, it was only 2 years ago then. And she was a lot of fun. She kind of cracked me up, but I guess she has a lot of experience with being a comedian.
Yeah.
And so she was a lot of fun. And we met her briefly there. I had a great time. I guess I gave a little bit of a presentation, and then we did an interview, and I felt like it went very well.
Yeah, it was great.
That need to be fixed. But I'm looking at the patient in a different way and saying, how can we also address the underlying process? And how can we reverse these processes? And also we want to go out and try to teach people how to prevent getting these diseases in the first place, which leads to just to fix problems. And I looked at patients and their problems as just, what is it I can go fix? As I've become plant-based in the last few years, what the way my approach has changed is that I still feel that there's a very valid place for fixing acute problems. Not only the atherosclerosis I treat, but all the chronic diseases that are that are so rampant in our society today. And it just so happens that there's one answer for all of that, and that's a healthy whole food. Talking about my professional work and our plant-based work, but personally, one of my big things, my big hobby, I'm sure it's no secret to many people, is sailing. We were able to go to our boat in February, and I was really excited because the prime sailing season in Florida is in the winter and the spring. And so I thought, okay, we're out in our boat. We had had some work done on the boat, and we went out in February to check it out, and the boat was in great shape. We had some engine work done. I checked it out. I was extremely excited. The engine is really nice. It's powerful, it's smooth, it doesn't make a lot of noise. It's more fuel efficient than our previous one. And I was just thinking to myself, okay, I'm going to come out to my boat, every month. Every month I'm going to go out there. And that was at the end of February. And we got back to Dallas, and everything changed. And so then so much for going to our boat every month, right?
If I can kind of add, it makes me a little bit sad when we talk about our sailboat because it's something you and I both love. Before we met, we both individually had an interest in sailing. You had experience, and I had an interest. I love the water. I love the sunsets. You want to say more about that?
Well, for us, that's part of our getting in touch with nature. I enjoy it because for me, sailing is I go where nature takes me. You're not entirely in control. You just wait for the wind, and then you go where the wind takes you. And I call it my Zen place. And so that was disappointing that we haven't been able to go back out like we want to. But then the other thing is, so I got to focus more on my guitar. I definitely was a beginner at the beginning of this year. But my good friend Joey Kukura, who headed up the Vegan Society at the University of North Texas, he had invited me out there last year to give a talk. And many of you know that it's a big-time music school, very well respected, and Joey was part of that program and just graduated. One of the things he does is guitar lessons. So I hit him up and I said, well, I've got some time on my hands. We started the guitar lessons just before COVID hit, and I was doing it weekly, and then once COVID hit, we went to Zoom classes, which worked out pretty well, and we were very consistent about it. So I did focus a lot on my guitar lessons.
Yeah. I've been trying to get him to have a song that we can use as the intro for our podcast. So right now there are some strings that you hear at the beginning of our podcast, but it's not Dr. Riz. I'm hoping that soon it will be you. So it'll be our music. It's really nice to see you play the guitar, and I have seen the improvement, and you know, we both love the guitar too. I don't play, but I enjoy it.
She doesn't scream at me saying, stop, stop, my ears are bleeding anymore. So
yeah. 2020 was a difficult year for many people. Political things happening, social groups, you know, trying to have a voice. So many things that were very difficult. And at one point I just had to disconnect so that I can function and be productive. And so that worked for me, all the ways that I stayed busy with podcasting, creating content, meeting wonderful people. My goodness, it was such a wonderful year in terms of who I met through the social, the virtual world. And then we had a setback.
what was that?
We got COVID.
Yeah, it's kind of interesting, and of course it was my fault. If you want to, she got COVID from me. Spending the months and months and months being just very diligent and really at a high anxiety level when you're at the hospital. I was double masking and keeping my distance and washing my hands and just thinking, gotta protect yourself, gotta protect yourself. And yet, despite that, I caught COVID. I didn't really know I had it. I just felt a little bit crummy, like maybe tired, like I didn't sleep well the night before. And I actually was done for the afternoon and went and took a nap at my office. I have a little recliner where I can rest if I need to. When I woke up from my nap, my nurse comes over and says, "Hey, Dr. Riz, so-and-so just called." And it was the anesthesiologist who had done my cases a few days earlier. She just lost her taste, her sense of taste. She got tested and she came back positive. I'm like, oh no. So there was possibly somebody I was exposed to who was relatively close to me. And I went and got tested the next day and I was positive. And by the next day, I was experiencing some fevers and chills, some myalgias, and just feeling tired. But fortunately for both of us, it was not a terrible course. You know, fairly well controlled. I mean, we were sick, but fairly well controlled with Tylenol or Advil, and fairly short course. It was gone in 4 or 5 days. You know?
Yeah.
I like to think it's because, you know, we live a healthy lifestyle and we're plant-based, and so our bodies were well suited to defend themselves. In fact, that brings up a point which, you know, Maya talked about, the PCRM course in nutrition, or how to treat COVID with nutrition, which we were a part of last year, and we're going to be a part of in this January. And something I've been telling people is that the same concepts for plant-based nutrition that you use to make yourself healthy apply to COVID. When you think about it, the whole food plant-based diet reduces your risk or eliminates diabetes, hypertension, cardiovascular disease, and obesity. Those are the main things that we are fighting when we're dealing with you know, these comorbidities, and you can treat with plant-based nutrition. And similarly, those are the same, interestingly enough, those are the same comorbidities that put people at higher risk for complications due to COVID. So in a similar way, a plant-based diet, a whole food plant-based diet, is, in my opinion, probably one of the best things you can do to protect yourself and make yourself healthier, so as to not succumb to the complications of COVID. Even if you get COVID, hopefully your course won't be as bad.
Mm-hmm. When the pandemic happened, and as it was developing and spreading in other countries before it hit us, I was paying attention. Of course, I was mortified and I was scared, and I wasn't sure if it was going to come our way, but I took it seriously, and you and I had a talk very early on about the risks. We always knew that the risk of you being a healthcare worker were higher because of that.
I mean, I'm working with COVID patients on a regular basis.
Yeah. And I knew that, for me, it wouldn't be a problem to isolate, but I still was doing groceries. And so I was still having to wipe everything down and take precautions and wear the mask and everything like that. But when all of that happened, you had plans to go for the weekend to the boat to check on it and do some things. And it immediately, we thought our life had come to a stop already. When you get COVID, and you have to self-quarantine, it's even worse because we didn't want to put anybody at risk, and we knew we weren't supposed to be anywhere, so that was even harder to get through 14 days of being at home. And
yeah. Especially when after 5 days we didn't feel bad anymore.
Yeah.
And so I joke that I pretty much used up the internet. Or there was nothing left on Netflix for me to watch anymore.
Right. So as far as like questions that people would have had, things that I was afraid to have and I didn't experience. So no shortness of breath, no reason to go to the hospital. I think maybe one day I had temperature.
You only had temperature one day, yeah.
One day because I was checking it all the time. Initially, I think we did pretty well over the year. Eating a lot of greens, exercising, taking care of ourselves, managing stress, that's important for me. I felt like I was doing the right things, and I deliberately in 2020 was taking care of myself because I didn't want to get sick. And if I was going to get sick, I wanted to be strong and go through it. But what I did notice that really stood out is I had absolutely no energy. Body aches are real, like people say, and the headaches were bad.
Yeah. Well, that's where, I think, interestingly enough for me, the Tylenol or Advil controlled all the symptoms.
Yeah.
Interestingly enough, you and I both had the flu last December when we came back from Hawaii, after we came back from Hawaii, so mid-December, and that was much worse than what we experienced with our COVID experience. It's funny, you and I were probably theorizing, I wonder if we had COVID back then, right?
Yeah.
But obviously we didn't. Yeah.
So he's talking about December of 2019. We had been traveling a lot. You gave a lecture almost every month, and we had just returned from Hawaii. And I remember bringing in the new year feeling under the weather and asking Marla, this is how I feel. Are you okay with that? She's like, if you can come, it's okay, at least for a little bit. But I did get tested for antibodies because I thought that perhaps somehow I had already been exposed to COVID. But we made it through the 2-week quarantine. I did still feel very fatigued and lethargic for about a week after. And then I pretty much feel like how I used to feel before. So I'm very grateful for that.
We're very fortunate. There's a lot of people who are having extensive and significant post-COVID syndrome type stuff. It ranges from pulmonary complications, cardiac complications. Pulmonary complications where their lung capacity is down 30-40%. Cardiac issues, chronic fatigue syndrome type symptoms where brain fog. Post-COVID syndrome issues are very real. And I'm just grateful that we are fortunate not to have experienced it.
Yeah. So just kind of wrapping up the year, we spend the holidays alone. Thanksgiving, Christmas, New Year's. So we felt it was the most responsible thing to do, that even though we had been exposed and went through the COVID experience, my mom was in town about a week after we were done with COVID, and I didn't want to take the risk of exposing her. So I haven't seen my family all year, like many of you, I'm sure. Let us know what it's been like for you guys. We came out of that, and then we decided to make, towards the very end, which is why we started off this year kind of tired, we decided to make a bunch of cooking videos. So on Thanksgiving Day and on Christmas Day, we were actually cooking in the kitchen, making YouTube videos. You kind of took some initiative and made some delicious apple crisp and blueberry crisp, and we did all kinds of things that we had never done before because we were never home for the holidays.
Right. Normally we would travel.
Yes.
And we most often would be on our sailboat for Thanksgiving and or Christmas /New Year's.
And so all the effort into creating content for our YouTube channel took us from, in May, I think we only had like 200.
About 200, yeah.
Subscribers, and we finished off the year with over 1,000.
Yeah, we're like at 1,100, yeah.
It was all because, we just wanted to create helpful information that can help you get through your year as well. And so what can we expect for 2021?
Well, let's see, 2021, I got my my vaccination. Yeah,
Yay!
My first round. I think I got it at the end of December.
it.
So I'll have to go back for my second round. Interestingly enough, it's the most uncomfortable vaccine I've ever had.
What do you mean?
Yeah, my arm hurt for 2 days, and I had mild COVID-like symptoms. The following morning, I woke up with a headache and some muscle aches, and I was kind of lethargic. You probably don't know because I took my Advil and went to work, and then it was gone. Because
because it was like 24 hours or 48 hours of that.
By the time I came home, I mean,
It was
I
done?
took the Advil, and in 2 hours, all the symptoms were gone, and they never came back.
Wow.
Yeah. I want to clarify that those are not side effects of the vaccine. That's what the vaccine's doing. It's actually inciting an immune response with the immune. That's what happens when people mount an immune response. They get a fever, and they get lethargy, and they get myalgias. And so that's just your body mounting an immune response. It's developing the antibodies necessary to fight COVID. And so that's those, in my opinion, those are just kind of expected things, a part of getting the vaccine.
Yeah. Again, it's like what I've said. I'm not here to promote that you get vaccinated or not get vaccinated, but we always agree. I believe in personal responsibility, and you could get someone sick if you're sick and don't have symptoms. You can kill somebody. I mean, I was infected, but I had been isolating the entire time. So I didn't kill anyone. I didn't put anyone out of work. I didn't get anyone into the hospital. And so it was because I was practicing social distancing. And really, I was isolated most of the year. But my thing is that I know that sometimes you can't help it because you have to go to work, and exposures happen at work. But when you have, when you have a choice of just kind of keeping your distance, wearing your mask, I mean, just do it. I asked Dr. Riz how people can learn more about the vaccine because there's so much misinformation and these scare tactics that are being thrown out there to discourage people from. Why are you smiling like that?
Oh, there's a lady I knew who didn't want to have it done because she said it would. She heard it might make them infertile. She's in her mid-40s, and I said, "Do you want to have children?" And she said, "No." And I said, "Well, then what are you worried about?" But I mean, that is misinformation.
Yeah.
So if people want to know more, the CDC has a lot of information, detailed information about the vaccines, and lots of questions and answers and stuff like that.
I've been seeing a lot of plant-based doctors post photos of themselves being injected, vaccinated. I find it interesting that people in the plant-based community, not everyone, but some are still afraid. And again, that's your personal choice. I don't have anything to say about that. But when you hear people say, well, it's not natural to get vaccinated. Well, there are a lot of medical treatments that happen at end of life that are not natural. So there are a lot of things that medicine does to keep us alive and healthy. I haven't heard a valid argument for not taking a vaccine, especially when the first people to receive the vaccine are people on the front line and people over 65.
Very high risk, all the very high risk.
Why would you
people.
want to kill everyone on the front line if that's what the vaccine does?
That's a discussion for another time. What else is next? I mean, I guess we're going to continue to put out online content, YouTube and podcasts.
Yeah.
We have some wonderful guests lined up this year. Very excited. Continue to hope and pray and work towards seeing that light at the end of the tunnel and moving towards that light at the end of the tunnel where we'll get back to a more normal post-COVID world.
Yes. There are topics that I really want to focus on this year on our podcast. So we continue to want to talk about the environment. And how food choices affect the environment. I'm also interested in having more people come on and talk about mental health because so many people struggled with isolation and loneliness. The suicide level was crazy last year. And so how can we continue to support each other and have a sense of community when we're alone and not being able to touch each other? So I'd like to have more experts come on along with all the doctors that come on and talk about lifestyle medicine and nutrition. And again, PCRM, the Physicians Committee for Responsible Medicine, they do such a wonderful job with their content. In this 8-week program that starts on January 19th, they teach you how to start from the beginning to become plant-based. So they teach you how to do groceries, they teach you what to have in your pantry, they teach you simple meals, how to eat out, how to travel. They teach you how to cope when you don't have any support at home. So there are a lot of tools, and we're very honored to be we're going to be part of one of their classes. So just join. We'll put the link below so that you can learn more about that. But anyway, we want to encourage you. 2021, we think might be a little bit more of the same with 2020. So let's continue to encourage each other. And one of my goals also is for us to be able to go live, so that if you want to come on and ask us questions when we go live, then we can answer some of these things and some of the concerns they may have.
Yeah, let us know if that's something that interests you. Yeah.
Yeah. So.
Or let us know in general what you want to see and what you want to hear.
Yeah.
Certainly we want to do stuff that you're interested in.
Yeah, and hopefully, more participation in online summits. I have a whole list of content that I would like to create. And I've added a segment to our YouTube channel, another playlist kind of segment. And this one's going to be like cook and read plant-based. So I did a lot of reading in 2020. I love to read. So it's a combination of giving you a book review by one of these wonderful plant-based advocates and cooking one of the recipes. And then of course, Dr. Riz in the kitchen will have more segments as well, because we know you like to see him in the kitchen. And so we got through to 2020. It was tough, but
how everybody was saying, looking forward to 2021, and God played a little joke, and when we woke up on January 1st, it was actually December 32nd, 2020. So, thank God that didn't happen.
Yeah.
All right. Well, I hope you guys enjoyed our recap. We're looking forward to seeing you out there in the online world.
Have a wonderful 2021, and please leave us a comment below. Tell us what was the best thing that happened to you in 2020.
Bye-bye.
Been listening to the Plant-Based DFW podcast show. If you like our content, please like, share, and leave a review. Our goal is to provide quality episodes to help support the community.
Because his eyes are rolling in the back of his head.
Do you like it?
Hope it doesn't cause you to explode or something. I think there's 14 of them. Blondie's going for a swim.
Look at the struggle, honey, to get up. You see it?
Hey, George, can you hear me? George, where are you? George, this is an old telephone. This is the way they used to do it in the old days. With the tin can and the string. Can you hear me, George? Hello?
One. Happy New Year's!
Happy New Year!